Hi, I'm Dr. Mark Faber, and I work with the Children's Institute, both in Verona and Livingston, New Jersey, and I also practice in Upper Montclair, New Jersey. We're going to speak about ADHD, both as it relates to children on and off the spectrum, as well as for teens and adults. We know that in making a diagnosis of ADHD, we're looking for three general areas of concern: difficulty with attention and focus, planning, organization, task completion, what we may refer to as executive functioning concerns. A second area is impulsivity, a tendency to act before thinking, and motor restlessness. We know that ADHD has its onset before age 12, and to make the diagnosis, you have to see certain behaviors in multiple settings, and it has to interfere with functioning. So if we were to look at 3 children in kindergarten with ADHD, the likelihood that one would have this by senior year of high school, we know that 1 out of the 3 may quote unquote grow out of their ADHD, and 2 out of 3 still exhibit ADHD in a somewhat different form. As kids grow older, motor restlessness decreases. Impulsivity, such as blurting out or interrupting, may change to impatience, and the distractibility is often persistent. In looking at ADHD, we also want to rule out other factors that can present like ADHD. For example, sleep disorders such as obstructive sleep apnea or periodic limb movements in sleep. Limb movements in sleep can be associated with restless legs during the day, and with sleep apnea and limb movements in sleep, the quality of sleep is disrupted, and the next day a person may appear distracted, impulsive, or restless. And finally, the 3 types of ADHD, which we now refer to as presentations, include the inattentive presentation, hyperactive impulsive presentation, and the combined presentation. ADHD is often associated with other types of mental health concerns. In fact, we know up to 2/3 of all individuals with ADHD may present with something else, such as a mood disorder, anxiety disorder, disruptive behavior, learning-based concerns. So very commonly, we see a clinical triangle, which is ADHD, OCD, and tics, and these can be seen together and may impact on our ultimate treatment for ADHD. In addition, other types of concurrent or comorbid conditions might include depression, other forms of anxiety, or even mood dysregulation, sudden shifts in mood out of proportion to triggers. So when looking at identifying and treating ADHD, we should always be aware that it may be seen with other kinds of things in the mental health area, and that these too can be addressed. Thank you.